Hello, I'm Marty Caniglio. Welcome to a special Dallas edition of American Health Front. Today, we'll explore how Texas Center for Oral Surgery and Dental Implants is using advanced surgical training, digital planning, and in-house lab technology to help patients restore missing or failing teeth with confidence. We'll also learn how Holy Savior Hospice is helping families better understand hospice care and how earlier support can bring comfort, dignity, and peace during a difficult time. Plus, we'll take you inside Blue Star Imaging in Frisco, where advanced imaging technology and subspecialty radiology interpretations are helping patients and physicians get clearer answers. As you watch today's show, you can scan the QR code on your screen during each segment to learn more about the doctors and practices featured, or you can scan the QR code currently showing to watch this entire program in its entirety at any time. So stay with us, because there's nothing more important than your health. Missing or failing teeth can affect far more than just a smile. Over time, they can make eating uncomfortable, impact speech, and slowly erode a person's confidence. At Texas Center for Oral Surgery and Dental Implants, thousands of patients have achieved success from access to a team of highly trained oral and maxillofacial surgeons who specialize in advanced dental implant procedures. The practice emphasizes surgical expertise, precision, a concierge-level experience, and a streamlined process designed to predictably restore both comfort and long-term oral health.
Many of the patients we meet have been struggling with missing or failing teeth for years. They're often unsure what their options are or whether their smile can really be restored in a predictable and affordable way. That's why the first step is always a comprehensive consultation where we take the time to not only understand where a patient is coming from, but really take a deep dive to understand where a patient wants to go. Dental implants allow us to replace missing teeth in a way that looks and functions like natural teeth while helping preserve the bone structure of the jaw. As oral and maxillofacial surgeons, we've completed years of specialized surgical training, which allows providing implant treatment at the absolute highest level of both precision and safety. For patients, dental implants can truly be life-changing.
For patients who have lost most or all of their teeth, modern full-arch implant treatment can restore an entire smile using a small number of strategically placed implants.
Full arch dental implant treatment is a major procedure, and experience matters when choosing a provider. All of our surgeons are board certified oral and maxillofacial surgeons, which means we've completed extensive surgical training and rigorous certification within our specialty. Patients often may not realize that surgery in the mouth is surgery that can affect the skull and the entire body. If somebody needed open heart surgery, they probably wouldn't choose a surgeon just because they were 5 minutes closer or a few bucks cheaper. Choosing us as oral surgeons is like choosing an expert pilot, where you can trust that you'll be okay no matter what comes up along the flight. These dental implant full arch cases are carefully planned using a fully digital workflow, and our team includes design and lab experts to ensure the highest level of customized outcomes for each patient. Using advanced imaging and digital planning, we determine exactly where the implants should be placed in order to support a patient's final set of teeth. One of the things that sets our practice apart is that we can perform every part of the process in-house, or we can collaborate with your dentist if you have one that you already love and trust. We have our own digital laboratory dedicated to full arch cases, which allows us to maintain strict quality control and make precise adjustments based on each patient's needs for function and aesthetics. Patients often hear the phrase teeth in a day, but it's important to explain what that really means. In most cases, we remove failing teeth, place dental implants, and provide a healing bridge of fixed or screwed-in teeth the same day so the patients never leave without a smile. From there, we continue to refine and optimize until each patient gets the customized smile of their dreams.
The technology and expertise behind modern implant treatment can make the process more predictable, but the patient experience also depends on careful coordination and clear communication.
One of our priorities is making sure patients fully understand the process from start to finish. Implant treatment is an investment in long-term health and thriving even beyond wellness, so transparency is very important. Once we determine the scope of treatment, patients know exactly what to expect. There are no hidden surprises if additional implants or grafting or other procedures are needed to ensure the long-term stability or success of a patient's smile. Because everything is coordinated within our practice, from surgical care to laboratory fabrication, we're able to guide patients through each step with a very personal level of attention. We are the largest locally owned private oral surgery practice here in the DFW Metroplex. That means we can ensure operating with the highest level of integrity and maintaining your excellent experience throughout the entire process. We take pride in treating our patients the way we would want our own families treated.
I feel fantastic. It doesn't feel like anything's different in my mouth. It feels like I never cracked my tooth in the first place. So I eat and chew and talk as if nothing ever happened, and I think that's fantastic.
At Texas Center for Oral Surgery and Dental Implants, thousands of patients have achieved success from access to a team of highly trained oral and maxillofacial surgeons who specialize in advanced dental implant procedures. The practice emphasizes surgical expertise, precision, concierge-level experience, and a streamlined process designed to predictably restore both comfort and long-term oral health. With 4 locations throughout the Metroplex, the team at Texas Center for Oral Surgery and Dental Implants offers a unique combination of advanced surgical training, digital technology, and personalized care, which helps the patients rebuild not only their smiles, but their confidence and quality of life. When depression, different forms of trauma, or anxiety continue despite medications and traditional therapies, it can feel discouraging to keep searching for answers. At On the Mend Recovery in Dallas, Dr. Lisa Bassili, a board-certified anesthesiologist, offers innovative treatments like ketamine therapy for patients who have not found relief with conventional care.
Depression, PTSD, and anxiety can change the way someone experiences everyday life. At On the Mend Recovery, our goal is to help patients become whole again, mentally, physically, and emotionally. Many people who explore ketamine therapy have already tried medications or therapy and are looking for another option. Ketamine works very differently from traditional antidepressants. Most medications focus on serotonin or dopamine and can take weeks to show results. Ketamine acts on the brain's glutamate system, which plays a key role in learning, memory, and communication between brain cells. At carefully controlled medical doses, it can stimulate neuroplasticity, helping the brain form new, healthier connections. In simple terms, it helps reset pathways that may have become stuck in patterns associated with depression, trauma, or anxiety disorders. The patients who benefit most are often individuals with treatment-resistant depression, PTSD, or anxiety disorders who have not found meaningful relief with other treatments. Before beginning therapy, we conduct a thorough medical and psychological screening to ensure the treatment is appropriate. At On the Mend Recovery, every patient receives a personalized treatment plan, and treatments are administered in a safe, provider-supervised environment where patients are closely monitored throughout each session to ensure safety and comfort. Our focus isn't just symptom relief, it's helping patients regain clarity, resilience, and a better quality of life.
I started probably close to a year ago. The effects last. It's not a temporary fix, it's a change in trajectory, and I think that that's like It's really life-changing.
At On the Mend Recovery, innovative treatment and personalized care are helping patients find new possibilities for healing and move forward with hope. When many people hear the word hospice, they assume it means there's nothing more that can be done. But hospice is not about giving up. It is about providing comfort, support, and quality of life for patients facing a life-limiting illness. At Holy Savior Hospice, Shelby Smith is part of a team helping families understand when hospice may be appropriate and what that care can look like.
One of the biggest misconceptions about hospice is that it's only for the final days of life. In reality, hospice is available for patients with a life-limiting illness and a prognosis of 6 months or less. It may be time to ask about hospice when someone is having frequent hospital visits, increased pain, repeated infections, weight loss, falls, or a decline in daily functioning.
Another important thing for families to know is that hospice is not just for the patient. It is support for everyone involved. We work with each family to create a personalized plan of care based on that patient's needs, goals, and comfort. Hospice care can include your nurses, aides, social workers, chaplains, volunteers, bereavement support, medications related to the hospice diagnosis, medical supplies, equipment, and pain and symptom management. Care can be provided wherever the patient calls home, whether it's a private residence, assisted living, a nursing facility, and sometimes the hospital.
What also sets Holy Savior apart is the ability to care for patients with more complex needs outside of the hospital. With 24/7 access, same-day admissions, rapid response, and support designed to help prevent unnecessary ER visits. We also offer different levels of care depending on the patient's need, including routine care, continuous care, respite care, and general inpatient care for short-term symptom management. What we want families to know is that they do not have to wait for a crisis. The earlier hospice is called, the more support we can provide.
Holy Savior Hospice provides family-centered care focused on comfort, dignity, and peace for patients and their loved ones. For families with questions about hospice, learning about the options sooner can make a meaningful difference.
If you missed any contact information for the physicians featured on our program, you can watch the program again anytime on the American Health Front YouTube channel.
PTSD can affect far more than a person's thoughts. It can impact sleep, mood, relationships, concentration, and the body's ability to feel safe. At Mind and Body Medicine in Dallas, patients whose symptoms have not fully improved with traditional treatment can find a multidisciplinary approach that addresses both emotional and physical well-being.
PTSD, or post-traumatic stress disorder, affects the whole person. It can follow a single traumatic event or repeated trauma over time, leaving patients with intrusive memories, easy startling, nightmares, flashbacks, and feeling cut off from family and friends. In Mind-Body Medicine, we look at PTSD through a holistic approach. Our team includes psychiatry, pain and mind-body specialists, addiction support, and clinicians working together to better understand what is driving the patient's symptoms.
PTSD symptoms can be better managed through the use of ketamine-assisted psychotherapy, or KAP. A KAP session is when a patient and a therapist have a counseling session while the patient is administered a low dose of ketamine.
We're all familiar with what's called fight or flight, when your body mounts a really strong sympathetic response, such that you have heightened arousal, increased heart rate, respiration, nervousness, jitteriness. Well, patients with anxiety disorders and PTSD have that all the time. So one of the things we do is we can actually block or make numb the nerves that supply those very fibers to the head and neck, such that you get a hard boot or reset of the sympathetic nervous system in the brain, thus sharply reducing, and for a long period of time generally, the anxiety one experiences when they're having a crisis or an episode related to their PTSD.
PTSD is also connected to traumatic brain injury, where the effects of trauma can involve both emotional symptoms and changes in how the emotional and nervous system function. In the case of this patient, after experiencing traumatic brain injury, finding care in a facility like DFW Mind and Body that treats both the emotional and nervous system function made dramatic improvements in her way of life.
When I was first diagnosed with CRPS, I went to California for a program. But here we have one right here in Dallas, Texas. I can really tell a difference. I mean, not just about the brain injury, but I had some anxiety from everything and the stress at work, and it reduced my anxiety significantly. I mean, it's life-changing, and I'm really going to miss it whenever I stop going to the program.
There's no single treatment that is best for everyone with PTSD. Our goal is to understand the entire person, then build an evidence-based plan to help restore their quality of life.
They are just warm and caring, and they really care about you as a person.
At Mind and Body Medicine, PTSD care is personalized to the patient with advanced treatment options designed to help calm the nervous system, support emotional regulation, and improve the quality of life.
Coming up later in the show, when pain or injury needs a closer look, Blue Star Imaging shows how advanced imaging and expert interpretation can help guide care with more confidence.
When you hear the words root canal, most people think of pain. But that idea is outdated. Today, root canal treatment is no more uncomfortable than having a cavity filled, and it's designed to relieve pain, eliminate infection, and save the natural tooth. At Rockwall Heath Endodontics, Dr. A.J. Galati specializes in treating the inside of the tooth, helping patients get out of discomfort and back to normal quickly.
A root canal is used to treat infection or inflammation inside the tooth. When the pulp becomes damaged, it can cause significant pain or lead to more serious issues if left untreated. During treatment, the infected tissue is removed and the canal spaces are clean-shaped disinfected, then filled and sealed to protect against future infection. With modern technology and anesthesia, the procedure is very comfortable. For most patients, it's no more uncomfortable than having a cavity filled, and it can often be completed in one visit, sometimes two, depending on the tooth. One of the biggest misconceptions is that it's better to remove a tooth than save it. In reality, preserving the natural tooth is almost always the best option. It allows patients to maintain normal chewing function, avoid additional procedures, and keep their natural smile intact. Once treated and properly restored, the tooth can function just like a natural tooth. Patients are able to bite and chew normally again, often for many years or even a lifetime. The goal is to eliminate pain, preserve the natural tooth, and provide a long-term solution that supports overall oral health.
I had other root canals done by other endodontists, and then I found Dr. Galati, and I would never go to anybody else. He's done a great job. He's sweet, he's gentle. It's a painless experience. He calls and checks up on me afterwards. He's just so considerate, and his staff is so kind and always very gracious. Anyway, I'm just really happy with every experience I've had here.
At Rockwall Heath Endodontics, advanced technology and specialized care are helping patients save their natural teeth, restore comfort, and get back to living without pain.
If you missed any contact information for the physicians featured on our program, you can watch the program again anytime on the American Health Front YouTube channel.
Pain can affect nearly every part of daily life. It can limit movement, reduce strength, interfere with training, and make even simple activities more difficult. At Dallas Physical Therapy, Eric Manalanson uses a focused, data-driven approach to help patients recover with greater precision and measurable progress.
At Dallas Physical Therapy, we work with individuals who value efficiency, precision, and measurable results. Every session is one-on-one, personalized, and guided by real-time data. We track movement quality, force output, and tissue response as it happens. We make informed clinical decisions and adjust treatment immediately. Pain changes how the body moves. Movement becomes guarded, strength declines, and performance narrows. When that pattern continues, it can reinforce itself. Targeted interventions at the right time help reduce that response, restore confidence in movement, and prepare the body to load, move, and perform again.
This approach combines hands-on care, movement science, and advanced technology to better understand what is limiting progress and respond with treatment that is both precise and personalized.
A key part of our approach is electromechanical transduction. This is where manual medicine and advanced biophysical agents are integrated into one coordinated system. We introduce specific forms of energy in a controlled, precise way to help modulate pain, improve circulation, reduce inflammation, enhance tissue recovery, and restore neuromuscular coordination. What makes that important is that treatment is guided by objective data. We measure the response, adjust in real time, and build the plan around what is changing in that patient's body. Our goal is simple: restore the ability to move, load, and perform at a high level. When care is personalized, measurable, and responsive, recovery becomes more efficient and more effective.
I had lower back pain, and it would be tough to literally get up out of the chair. And of course, I couldn't work out or walk or anything else.
Well, I couldn't stand for more than 10 minutes, and I couldn't sit for more than 10 minutes. So I was constantly up, down, all day long. Being at work conferences was awful. I couldn't just function normally, and then also trying to maintain my presentation and meeting and talking with people without them knowing that I was in pain was a difficult challenge.
But I came, and through all the different things that Eric did, that pain was relieved. And so I'd then be able to walk, and literally just the pain went away. I don't know how else to describe that.
Where it is now is I have zero pain. I'm able to stand and sit and do all my activities, Pilates or bar class, without any pain at all.
Sometimes I would literally come in here and in one treatment, I would walk back to the car, and before I would sit down, I would be better. So they were all very effective treatments.
At Dallas Physical Therapy, hands-on care and advanced technology come together to support measurable progress and a more precise path to recovery. When symptoms keep getting worse, many patients go from one provider to the next, looking for answers, but never really understanding why they feel the way they do. At Health Connection Integrative Medicine, Dr. Frank Alamia takes a different approach, using functional medicine to look deeper, identifying underlying causes, and create treatment plans tailored to the patient.
Functional medicine is about asking why a patient is having symptoms in the first place. Instead of only treating the surface problem, we look deeper for underlying issues that may be contributing to fatigue, inflammation, weight gain, digestive problems, hormone imbalances, or chronic pain. That process starts with detailed testing and a thorough evaluation so we can build a treatment plan that's specific to that patient. One patient came to us after struggling with severe joint pain and swelling. Even after seeing her primary care doctor, an orthopedic, and a rheumatologist, she continued to have pain. She was only 30 years old, but she was exhausted, had gained significant amount of weight, and was no longer able to live the way she used to live before. We did more specific testing and found an underlying parasite issue that was driving inflammation throughout her body and causing the pain.
After about 4 months of being in dire pain with my foot and not being able to walk, I was pretty much infested with parasites, which caused all the pain and swelling. I had gone from a size 6 to a size about 12 in about 3 months.
Once we identified the cause, we put her on a targeted program, and within weeks, her pain improved, her energy came back, and she was able to start going back to her life.
About 15 pounds, and I'm no longer walking like a cripple. My pain has decreased to a 0, and I'm just super excited and can't wait for the future.
We also offer regenerative medicine for patients dealing with joint pain, soft tissue injuries, and reduced mobility. Treatments like PRP and stem cell biologics are designed to support the body's natural healing process and help repair damaged tissue.
At Health Connection Integrative Medicine, patients have access to care that looks beyond symptoms to identify root causes and support healing in a more personalized way. Medical imaging often plays a critical role in diagnosis, treatment, planning, and recovery. At Blue Star Imaging in Frisco, patients and referring physicians have access to advanced imaging technology and expert radiology interpretations in an outpatient setting designed for comfort, efficiency, and clinical excellence.
At Blue Star Imaging, our goal is to provide high-quality imaging and accurate, timely interpretations that help guide patient care. The scan itself is important, but the interpretation is just as critical. That's why our studies are allocated to radiologists with subspecialty training. What that means is that the physician reading the exam has focused expertise in that area of the body or type of imaging. A musculoskeletal study, for example, may be read by a radiologist with advanced training in bones, joints, ligaments, tendons, and sports-related injuries. That level of specialization can make a real difference in identifying subtle findings and giving referring physicians the information they need.
That combination of advanced imaging and specialized interpretation is especially important when patients and physicians are looking for clear answers, whether the concern is a sports injury, joint pain, or another medical issue.
Blue Star Imaging is known for its work with athletes and sports medicine, but our expertise goes well beyond sports. We offer a wide range of diagnostic imaging services supported by state-of-the-art technology and ACR-accredited standards for image quality and safety. We also provide image-guided steroid injections, which can help patients with joint pain find relief without surgery. We understand imaging can be stressful for patients. Our team works to make the experience as comfortable and efficient as possible, from scheduling through the exam itself. Whether someone is here for a sports injury, joint pain, ongoing pain, or another medical concern, the focus is on clear images, expert interpretation, and an overall better patient experience.
At Blue Star Imaging, advanced imaging and expert radiology come together with a patient-focused experience, helping patients and physicians move forward with clearer answers and greater confidence. Well, we've given you a lot of information today, and we hope it's been helpful. If you missed any of the phone numbers or names mentioned in today's program, you can re-watch this Dallas edition on the American Health Front YouTube page. For everyone on the program, I'm Marty Caniglio. Thanks so much for watching, and please join us next time for the American Health Front.
Welcome to Comfort Inn & Suites Las Colinas DFW, located right here in Irving off Walnut Hill Lane. We're just minutes from DFW Airport and the Irving Convention Center at Las Colinas, making our hotel a convenient choice for business travelers, meeting attendees, and guests exploring the DFW area. Our guests can settle into spacious rooms with thoughtful everyday amenities, including comfortable bedding, free Wi-Fi, a workspace, refrigerator, and microwave. Each morning, we offer a complimentary hot breakfast, along with free parking and access to our on-site fitness center to make every stay simple and comfortable.
Whether you're here for work, travel, or just a relaxing stay, we welcome you to Comfort Inn & Suites Las Colinas.
Thank you.